Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hello, and this is Chase DiMarco, host of the Medical Nemesis podcast, filling in for Dr. Renee Martinelli. Today, we are joined by Dr. Brad Spellberg. Brad, how are you doing today?
I'm very well, thank you.
Great. So you're an infectious disease specialist. You're the chief medical officer at the Los Angeles County and University of Southern California Medical Center and director of Biosciences for Los Angeles County. This is quite a mouthful right here. You're all over the place. And we're not even going to discuss this. We're going to discuss your new book. I guess briefly, let's just dive into a little bit about your backstory. And the book that just came out is Broken, Bankrupt, and Dying: How to Solve the Great American Healthcare Ripoff, which is quite an inciting title, I have to say. So I think this is going to be a great topic. A lot of us in medical education or medical students we're flustered by the complexities of the healthcare system. So diving into these topics a little bit more is going to help a lot in guiding students and educators. But what made you decide to pick this topic for your next book or for your current book?
You know, when I became the CMO or Chief Medical Officer at LACUSC, which is one of the largest public hospitals in the US about 6 years ago, and had to immerse myself in figuring out how to streamline our patient care, how to improve efficiency, flow through, optimize patient outcomes, you are immediately confronted by this Byzantine morass of insurance networks in the United States that no other country has put in front of doctors and nurses who are struggling to take care of their patients. And, it's hard for me to figure out for any given patient, are we allowed to take care of this patient? Where are they supposed to go? What's their follow-up going to be? Can we see their images? Are they going to see art? I can't even, for frontline providers, for frontline doctors and nurses, come on, it's ridiculous. And so the motivation was years of pent-up frustration that me and the thousands of people who work for me feel every day trying to take care of patients, even in the safety net in this country.
Yeah, there is definitely a lot of red tape. I remember a few experiences in clinical rotations where even the preceptor I was following at the time would have to go to 3 different departments to get all the information he wanted. And some people would incorrectly state that they couldn't share this document because of a HIPAA concern or something along those lines. And it just gets so convoluted, and that can't help but be a detriment to patient care.
Yeah, well, the numbers bear that out. So the fact is, Americans spend enormously more money in absolute dollars, $2 trillion more dollars per year than the next most expensive healthcare system in the world. And for the privilege of dying younger. So we live shorter lifespans and pay way more than anyone else does.
Wow, that's sort of depressing, I have to say. All right, so then let's get down to some of the comparisons here, because there are a lot of different systems in the world that we can compare ourselves to, and there are going to be some pros and some cons for each system, obviously, and their demographic that they're serving. But in general, how does the U.S. healthcare system compare to some other countries, and what outcomes should we be looking for when we're comparing these?
Yeah, that's a great question, Chase. Probably the biggest expert group out there that objectively ranks and compares international healthcare systems is the Commonwealth Fund. The Commonwealth Fund is a nonprofit, nonpartisan think tank based in the US, and it every few years releases an updated list of the performance of 11 peer wealthy nations' healthcare systems. Most of those are in Western Europe, but it includes New Zealand and Australia. We'll come back to countries like Taiwan, from which we can learn a lot from as well. They're not included in those rankings. Where does the US rank overall out of those 11 countries on healthcare? We're 11th, dead last. Now, they break down those overall rankings into categories. So there's things like efficiency of care, equity of care, accessibility of care, and outcomes. And what's outcomes? Outcomes is how well does the healthcare system prevent death for diseases that are amenable to treatment? So not do you stop people from getting hit by buses, but do you treat diabetes effectively? Do you treat pneumonia effectively and appendicitis and things that we know if you treat properly, you can do well? Where does the United States rank on healthcare outcomes out of those 11 countries? Dead last, 11th out of 11th. Pun fully intended on dead last. You know, Chase, if you're going to lose on something in healthcare, lose on the food in the hospital doesn't taste good. Don't lose on death. That's like the whole thing of healthcare is like keeping people from dying.
It definitely seems like that should be the main concern. And I think I probably agree with the outcomes here. We get distracted by surrogate markers that don't necessarily improve these outcomes or improve any measure that we should really be focused on. But maybe it's just me, but it seems a little confusing as to who makes all the decisions of what we should really focus on. Is it up to the doctors? Is it up to the hospital administrators? Is it up to the local or federal politicians? And I guess those are some topics we might get into a little throughout this conversation, but it is a very complex system that just leads to a lot of uncertainty from the point of the physician anyway, as to how much power they have and where to turn and how to make things better.
Yeah, so I tell numerous stories in the book about patients that I've cared for where the issues that you're talking about come up constantly. Are we allowed to take care of this patient? Are they going to be able to afford the medications that are prescribed? They're bouncing back and forth because they're out of network, they're in network, they don't know who their treating provider is supposed to be. Our system is so confusing, even for patients who have insurance. They half the time don't know where they're supposed to go. And even if they're in network, they have gaps in their health insurance, like deductibles and copays and co-insurance that don't exist in other countries. And that's for people who have insurance. We have more uninsured patients in this country than almost any other industrialized country. There's 36 countries that participate in something called the OECD, Organization for Economic Cooperation and Development. And of those 36 countries, we rank 35th in percent of population that is insured. The first 25 of those countries insure 100% of their population, and we're down at around 90%. And that 90% is with the Affordable Care Act, which insured 18 million more Americans than existed before the Affordable Care Act. So if you don't have health insurance, you ain't getting good care anywhere.
Agreed. Actually, I don't have health insurance, so I fall into that category personally. And that brings up an interesting concern for a lot of people is just the expense of the healthcare system and what the options are. And as a comparison, I don't even know how to compare this when you have different technologies, different exchange rates, probably a lot of different financial concerns when making this calculation. But how expensive is the US healthcare system compared to other similar countries?
Yeah, I'm going to answer that in a couple of different ways to show you that no matter how you answer it, the answer is we are number one. And that's like the one thing you don't want to be number one in. But I would like to just take a moment to recognize the remarkable thing that you just said. You are a successful, hardworking, young American business person without health insurance. Many, many people who lack health insurance are in this. They're not employed by a large employer, so they don't get insurance through their employer. They're independent contractors or work for small businesses. They can't afford their own insurance. That is catastrophically bad if something bad happens to you that's out of your control. Get into a bad car accident, have appendicitis, develop a bad pneumonia that you can't stop from happening. These things just happen in life. This is an inhumane way for us to treat people in this country, especially hardworking people that are working to make a living. How expensive is our healthcare? I mentioned overall cost, $3.65 trillion in 2018. If our healthcare system was its own country, that would be the 5th largest economy in the world. We spent more money on healthcare than the total value of all goods and services across all economic sectors in the United Kingdom, for God's sake. You could also see, yeah, but we have a lot of people in this country. There's 340 million people. So let's do a per capita cost. Smaller countries, they're going to spend less money. Fine. We spent $11,200 per person in the United States on healthcare. The average Western European nation spends about $8,000 per person, $7,000 to $8,000 per person. We're 50% more than our average Western European competitor. Now, you could say, yeah, but we have this booming economy, all this wealth. Of course, things are more expensive. Okay, fine. Let's look at cost per GDP. Let's normalize our cost to our economy. We're at 18% of GDP for our healthcare costs. Most Western European countries, 10% of GDP, nearly twice as much. No matter how you calculate it at a national level, we're getting ripped off. Now, just one more point. Let's look at somebody like you that says, you know what? I understand I'm an independent contractor. I got to buy my own insurance premium. I'm going to scrape together the money. Kaiser Family Foundation last year released a survey of 2,000 employers, both public and private. What is the average cost for family health insurance per year, just to purchase the premiums, just to pay the premiums to purchase the policy? $20,000 per year for family coverage. That doesn't buy you health care. That just gets you the policy. You still have deductibles, co-pays, co-insurance. We are getting ripped off in this country.
No argument from me on that one. That is way more than I was projecting. And I thought my number of like maybe 12, 14,000 estimate was going to be high. And actual number is almost twice as much as that. So
for family coverage. Now, for individual coverage, the average was $7,500 per year, but that only covers you. And again, remember, you're going to have an average $1,600 deductible that's you have to pay out of pocket before your health insurance kicks in. You're going to have co-pays, co-insurance, and other gaps. So it still doesn't cover all your costs.
Wow. And we definitely have a large percentage of the population that's not going to be able to afford that. And I have plenty of acquaintances that have chronic illnesses and they're at a job that they don't necessarily want to stay at, but it's the only way they can get health insurance and maintain their health. So we are seemingly in this sort of vicious cycle, this loop. And I can't help but wonder what some of the primary structures are in the US healthcare system that kind of make the system the way it is and how it compares to other countries.
Yeah, that's a great question. We definitely want to talk about international models and we can learn from them. I think the first point I just really want to hammer home is why are we in this mess? I mean, who came up with the system? Who rationally sat down and said, yeah, let's make a system where you can't buy your insurance and you can't afford it? I don't know. No one. This system that we have in the United States is an accident of history. No one sat down and said, yeah, the way to deliver healthcare is to do this, and no. You know why we have the healthcare system we have where you can't afford health insurance and 530,000 Americans per year declare bankruptcy due to medical bills? It's because in World War II, they were worried about inflation after the end of the war, right? So here's what happened. After the end of World War I, as the Tommies came back, the American soldiers came back, and they re-entered the job market. And there was this spike in labor costs as people were competing to hire all these returning workers. Salaries went up, costs went up. There was a massive inflationary spike that crushed the US economy, led to national strikes, union strife, violence. It was a hugely turbulent time. The people who led America through World War II lived through that and remembered it. So when World War II hit, they got ahead of it by passing an act called the Stabilization Act. And the Stabilization Act was intended to prevent that post-war inflationary spike. It banned companies from giving pay raises. It fixed salaries in place. So now you have all these Americans going overseas to fight a war. While businesses were ramping up industrial production, they needed workers, and they couldn't give pay raises to lure workers into their factories. Well, one of the things that the Stabilization Act didn't cap was employee benefits. So companies began saying, oh, well, I can't offer you a pay raise, but I really need to hire you. I'll tell you what, I'm going to give you a rich benefits package with great health insurance. Now comes along the IRS. we need to raise funds for the government to buy all these pieces of equipment for war. We're going to raise taxes on everybody, corporations, individual, personal tax capped out at 90%. And we're going to take away almost all income tax deductions. But you know what? We're going to leave in place one income tax deduction. Guess which one that was? The cost of your insurance benefits. So your job benefits became deductible to your employer and your employee. And all of a sudden, health insurance companies were like, wow, what a gold mine. And they started putting together packages to sell to businesses so they could compete in the job market and give both the employer and the employee a tax deduction. And that is why today, your insurance to your employer is paid in part by your employer and in part by you. That is an accidental historical, it's the appendix of our healthcare system, right? No one intended it for it to work that way. It was an accident of fighting a world war and an attempt to prevent post-war inflation. And that's why we're stuck with this ridiculous system today.
Huh. Well, I guess, yeah, from a historical point of view, it makes sense where the need was there. So someone's going to step in and fill the gap. But now we are so far away from that. We're many decades later and we're still stuck. Yeah.
Let's rethink
So
it.
how do we do this? Because you hear of so many different things in the media and from politicians, from single payer to just expanding Medicare to this and that. What are some of the options here? And what are some of the pros and cons of these options?
Lots of options. I think the first thing I'll just mention is Taiwan went through a very similar problem with their healthcare system in the 80s. They had a multi-payer complex system that was costing incredible amounts of money. And in the 90s, they put a team of experts together and they fundamentally sat down and said, you know what, we're going to design intelligently a rational healthcare system. It took them 5 years to go from concept to implementation. And they have one of the best, most cost-effective healthcare systems in the world now. So the point is, this can be done if we have the will to do it. One of the reasons we don't have the will is that people tend to get stuck in inertia. Well, it's the system we have. It's working, we're using it, and you just lose sight of the fact, well, we're getting ripped off by it and people are dying. We could do better. So the first thing you have to do is accept the reality that we can do better. The second thing you have to do is get past partisanship. The thing that keeps sinking healthcare reform in our country is one party wants this, the other party wants that, and never the two shall cross. So you've got Medicare for All, which is essentially a single-payer health system, right? That's the government to collect central taxes and gives health coverage to everyone. And the fact is, this is nonpartisan. I'm a registered independent. I hate both parties equally, okay? I'm not in. Bottom line is this. Countries internationally that use single-payer models have amongst the best outcomes in the world and spend by far the least in the world compared to countries with multi-payer health systems. So they work. Now, there is a certain cultural adaptism to it, right? There are people in this country that are mistrustful of government. There's the don't tread on me ethos that goes back to the founding of the country. They're like, we want capitalism. We don't trust government. We want a multi-payer system. There are, in fact, multiple highly successful multi-payer systems in the world. The Netherlands, Switzerland, Germany, France, they all work. They all achieve much better outcomes than we do. They all cost much less than we do. So what do? Party A says, I want single payer. Party B says, no, we're not going to accept single payer. We want multi-payer. My answer is, why not do both? There is no reason you can't have a single payer system where everybody is covered by a national health plan. And for people who want, they can pay some extra and get private insurance in a multi-payer market. This to me is akin to driving in a fast track or toll lane on the freeway. When it's crowded, when it's not crowded, I'm using the public lanes. But when it's crowded, I'll pay a little extra and go over into the fast track lanes. I still pay my taxes for the public lanes, even when I choose to use the private lanes. There are countries in the world that do this. Australia and New Zealand are two examples. They are amongst the two highest performing healthcare systems in the world with the most cost-effective healthcare systems in the world. There's no reason we can't do that.
I think that's a great metaphor, the different lanes. You're still paying for it, whether you use it a lot or not, but then you get the best parts of both systems. And it sounds like that's an option that you rarely hear about from the politicians.
That's what baffles me, Chase. That's why I wrote this book. It's like, folks, if you're so convinced your idea is better and you're so convinced your idea is better, how about we do them both and let them compete? What's more American than that? Let them compete. And it does work because there's countries that do it and it works.
So then going forward, what is something that the current audience can do or should look for? How can they make a difference to bettering the system?
Yeah. One of the lessons that I've learned over the years, I spent a long time at the national level working on antibiotic resistance. And sort of like Al Gore's experience with global warming, I sort of naively thought if we just educate people on Capitol Hill, they'll fix the problem. And what I learned was the representatives on Capitol Hill vote for things that are important to their constituents. If we really want to solve this problem, it's not so much about talking to the senators and congresspeople. It's talking to the public. Let's make the American voter aware of how bad things are and how much better things are elsewhere, and how we can solve this in a bipartisan way that is compatible with fundamental US culture by doing something that other countries already do. And that will allow and empower our elected officials to make changes that are not so filled with strife. And so my answer is talk about it, hold meetings about it, ask a speaker to come in about it, write your congressperson, and perhaps most importantly, in 4 months, we're going to go to the polls and vote in what may be the most important election of this generation. Vote. Let's make our voices heard. Politicians do listen to their constituents. We just have to speak with a unified voice.
I like it. Well, where can the audience find out more about you or your book, Broken, Bankrupt, and Dying, How to Solve the Great American Healthcare Ripoff?
Book is on Amazon, and I do have a website. My email is on there. Absolutely happy to chat with people if they want to reach out.
Perfect.
And I'm on Twitter.
Great. Well, Dr. Brad Spellberg, thank you so much for coming on the show today.
Thanks for having me.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.